Dr. Fong, at one point you mentioned, teeth replacement, and you mentioned a thing called denture. I want to talk something very specific. Apparently there are, I don't even know what it is, 30 million people out there who have dentures. That's a lot. And it's probably overall getting, more because as baby boomers, start losing teeth and name it. So the point is here, I want to talk something specific. People keep coming back to a dentist and say, my denture is getting loose. And they think there's something wrong with the denture. Well, there kind of is, but there isn't. It's a little bit like with my pants. My pants are not getting loose. They're just getting tighter. It's not that there's something wrong with my pants. It's something wrong with me. I eat too much, too late at night. I'm gaining weight. But in the mouth, people are losing bone, as you said, and thus the denture becomes loose. So now they're starting using a lots of adhesives, dental creams to glue it on. And besides the fact that the thought of it just doesn't appeal to me, I mean, to have glue between your thing. But there even has been news out there where these dental adhesives have too much zinc in it, and they could potentially be nerve damaging. I've seen videos where people are nerve damaged mentally and physically. Nothing completely proven, mind you. But either way, you dentists have something now called an implant-supported denture, where you put 2, 3, 4 implants on it. Much cheaper than a whole roundhouse of implants, and apparently those dentures then sit, fit, work, and are just fantastic. Is that true? Is there a new technology out there which lots of people simply yet don't know that they can do this hybrid, this mixture of implants and denture?
Yes, absolutely. That option is available. Well, the way that it works is that depending if it's the upper or the lower jaw, a certain number of implants are placed into the jawbone. Those are used as posts for the denture to clip on or snap onto, and that will help to replace all of the missing teeth on the upper or lower teeth. So even though it is a denture, that denture becomes a lot more stable because it is attached to those implant anchors, and that helps to prevent it from moving or clicking. So it's a stable denture that is attached to the lower jaw or upper jaw.
That of course increases a tremendous amount of confidence in the people, because you keep hearing it. And have you noticed that when some people get a denture, especially if they get it a little, let's just say they're not very old yet, but it doesn't matter at what age more or less they get it. They get the denture and automatically they feel a little older, because obviously, again, we have grandma and her denture in mind, and we know denture. Yes. Denture means that's it. We're not dating anymore. Do you know what I mean?
Right.
It gives us this feeling of we're over the hill. And then when people apparently, when they sit at a Thanksgiving dinner or anywhere, they hold back from laughing. If they do laugh, they hold like that because they're not sure it falls out, even though it might never fall out.
Yes.
They're just less self-confident. Does this implant-supported denture totally eliminate that? And like it sits there and you just know it sits, and you have back your... Hey, I can laugh, and I can... actually, can you eat? Can you bite into an apple? Can you bite into a spare rib with one of those implant-supported denture or not? Because you can't do it with the normal denture.
Yes, you can bite into it. Once you snap on that denture onto those implants, it is locked in there. They're not going to fall out. You can have full confidence in it. In fact, to remove it, you actually have to pull on it in order to unsnap it off of those implant anchors. So you gain great confidence.
Wonderful. And it's, of course, a lot cheaper than having many, many implants because you're having so many teeth missing or whatever, right? It's a lot cheaper.
Yes.
Wonderful. Now, another question on that. When you have a normal denture, your palate is covered with some plastic or some metal, whatever it is the whole thing is made of, but you're really losing your taste spot. That's what they're saying. And what most of us don't realize on a daily life, we're not tasting the food with the tongue quite as much as we're tasting it with our palate. So can that be reduced? Is that like cover on the palate with the implant-supported denture still there, or is it gone and you can now taste food better?
Yes, you're right. The roof of the mouth, also called the palate, when it's covered, it reduces your ability to be able to taste and enjoy the food. You're not able to experience the textures of the food, and you're not able to taste it. Now, with the implant denture, we can create it in such a way where the roof of your mouth is exposed, and so you have a better opportunity to be able to enjoy the taste and texture of the foods, which will make it more natural and more enjoyable when you eat.
Beautiful. Me being born in Austria, and I don't know, food is just, but I think all over the world, I'm married to a lady from Taiwan, and the point is, it doesn't matter where you go in the world, food is important, and not tasting food is just not a good thing. So I love it. Now, a final question here. If people have a denture, without implant supported, just a normal denture, could they transform their denture to an implant supported denture without having to spend the money for a new denture, or is that not possible? You need to go and get a whole new set. How does that work?
It is possible to transition from your existing denture to an implanted supported denture. Now, I think it really would depend on the evaluation of the doctor, the dentist, to be able to determine if your existing denture is suitable for that type of transition. So it does require an evaluation to determine what is best for the long term.
I see. So basically, by suitable, I suppose you mean if the bones have shrunk already so much that your current denture is very loose, then it just might not be worth to put that on it. You better make a new one fitting the current situation and put it on.
Right, or it just might be a simple matter of updating your look, because maybe your existing denture has been ground down from over the times of your use. And so maybe it's time to update it to make it look more natural, because over time, that plastic on the denture yellows. Right. And if it's yellow, then that doesn't look natural.
Right. And also maybe you want to have slightly wider, slightly smaller, slightly longer teeth. Maybe you say, hey, I want to look a little different here, because you now have the choice with a denture. You can make them any size you kind of want, right?
Right, you can make them any size, you can improve on the color and brightness. It's your opportunity to make yourself look younger. And we all want to look younger as we get older.
No doubt. I mean, that's just so much. And it adds to, as you constantly say, to our self-esteem. And in the end, there is nothing which makes us feel younger than our self-esteem. But if there is a few things which help our self-esteem, then we should do those things. That's why they in Austria, for instance, in the German language, they have a sentence called Kleider machen Leute, basically clothes make people. And, while it's rather stupid to say so, but the point is, when we dress up slightly better, that's why we have a Sunday dress, right? Because we don't wear it every day. So when we wear it, automatically we walk an inch taller. And so I'm sure that. Wonderful. Thank you very, 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 very much, for, telling us this. This is an important, I'm sure this, it's nice to see that dentistry hasn't been left behind in terms of advancement in technology. It's not only computers with more gigabytes and faster speed, and there's something, technology has impacted dentistry quite a bit, it looks like.
Significantly, it sure has.
Beautiful.
We now have computer-aided design of crowns that can be made in one single visit, whereas in the past they required multiple visits.
Beautiful. It's all beautiful. And anyway, all those things we talked about, being able to eat and bite again. I mean, for a guy who doesn't have, all his teeth and has a denture and yet maybe doesn't have the money to put tens and tens and tens of thousands of dollars of implant in it, and all of a sudden it can be done. It's like he can smile again, he can eat again, and all that stuff. It's absolutely great. Thank you very much, Dr. Fong.